Hi and welcome back. In this lecture, we're going to talk about Key Insight 6, Workforce Transformation and the Future of Work as far as the healthcare industry is concerned. So if you look at the future of work, especially things changed a lot during the COVID-19 pandemic. So things like remote working, greater flexibility in terms of work hours, also empowering the employees to make better choices, prioritizing mental and physical well-being, and so many other changes have happened. And these changes will continue to move on, along with massive changes like the 4-day work week. Well, automation and augmentation, just like it impacts any other industry, would impact and transform the job roles and the responsibilities of the healthcare industry as well. So innovative cutting-edge technologies like robotic process automation, which is basically a software robot which can run on computing devices like smartphones, tablets, and laptops and perform a variety of tasks including things like copy-pasting, formatting, generating reports, downloading certain files, and so many other things which can be done on a computer. So these robots are very smart, and when combined with artificial intelligence can make decisions as well based on certain parameters and also have the ability to self-learn as well. So having these kind of advanced tools will help us to really understand the performance of different operations, whether it's onboarding patients and whether it's queue management. So all these processes can be understood in much more greater detail and fine-tune and optimize based on the workload or demand. And also from a healthcare professional perspective, you might have to upskill the skill set of the workforce, provide them with the right training and tools, and also address any kind of gray areas as well. And one of the most important things is to get their feedback when these systems are being implemented, because user resistance is one of the main challenges of implementing information systems. Then we are seeing another trend of new ways of training and continuous learning. So training and upskilling would be the norm of the future, because according to main reports by leading organizations such as the World Economic Forum, on average an employee will spend about 3.3 hours per week on self-directed learning. So not just technical skills and computer literacy and subject knowledge, but also skills like resiliency and adaptability, technological skills and digital fluency, communication across remote and distributed teams, emotional intelligence, cross-functional collaboration, leading through change management, dealing with stress and being more mindful, time management, creativity, analytical thinking and innovation, things like active learning and learning strategies, complex problem solving, critical thinking and analysis, leadership and social influence, and other skills like reasoning, problem solving, and ideation. So basically using technology tools to continuously keep themselves up to date with the latest best practices and also upskill themselves with the skills that are required within the industry and also within the world. Then there would be greater focus on employee engagement, because if you look at this whole COVID-19 pandemic, a lot of healthcare workers were under tremendous pressure and were forced to quit, and most of them experienced burnout. So it's not a good thing, because when you feel burnout, your concentration and decision-making ability is hindered. So a lot of healthcare providers are starting to realize the importance of this and are using advanced technologies like wearables and other sensors to continuously monitor the physical and mental well-being of professionals, including any signs of burnout or high stress levels. Then we are noticing other trends like increasing workforce mobility and flexibility. So there's a growing trend globally of the rising workforce mobility. So giving people much more flexibility over their careers and work schedules. So healthcare workforce will also experience this to a certain degree, because things like remote diagnosis and telehealth would give them some sort of flexibility where they can work from anywhere, even from home. Then another trend that we're noticing is a mass retirement, resulting in a massive skill gap. So if you look at the baby boomers who were born from 1946 to 1964, they have reached the retirement age and they have a tremendous amount of expertise on one hand, but also on the other hand you have a new generation of people coming into the workforce with unprecedented levels of technological change and the rapid shift of different job roles as well. So bridging this skill gap is a massive challenge. So according to SHRM, it was estimated that nearly half of the current registered nurses in the United States would reach retirement age in the year 2020. Then we are noticing another trend, which is reimagining the healthcare delivery models. So innovative delivery models like telehealth, which facilitate healthcare professionals to work remotely, maybe for a few days of the week, rather than coming to the healthcare facility regularly. So these kind of opportunities and changes didn't exist before, because you had to be physically present with the doctor or the healthcare professional in order to be diagnosed. But now things are moving to a much more hybrid approach. But also if you look at from patient perspective, it doesn't matter what kind of resources you have, as long as you have good internet access, you're able to consult the best healthcare professionals in the world. And also the transferring of skills will be much much more easier because you can get expertise, you can connect with expertise, collaborate at a much more better level with expertise around the world, with best in the industry all around the world, and then upskill yourself as well. Because there's a higher sense of collaboration, it would be very easy to overcome challenges because there might be someone out there in the world who have gone through the same issues that you're experiencing right now, and even if it's a completely novel issue, you can leverage a pool of global experts and overcome the challenges in a very collaborative manner and build your own internal capabilities as well as contribute to the entire industry as well. Then we're starting to notice other trends as well, such as rethinking the talent pipelines and bridging industry and institutional gaps. So understanding the industry requirements and aligning the healthcare education and skill development accordingly is also something that we're seeing, because if there's massive changes in the world, it's important to align or streamline all the processes and make things more agile in order to stay up to date and relevant. Then we're also seeing a greater focus on diversity, equity, inclusivity, and belonging, on what we call DEI and B. So we're seeing this trend all around the world where a lot of companies are focused on hiring a diversity officer who is really focused on ensuring diversity, equality, equity, and inclusivity, as well as create a sense of belongingness within the company as well. And the healthcare industry is no exception, so there would be greater focus on creating more opportunities and also support networks for everyone and having a voice to be heard. Well, that's about it for Key Insight 6, Workforce Transformation and the Future of Work. I'll see you on another lecture.